All right, Liz Jones and Kari Melby here from Jones PT. Another quick little tidbit for you. Again, the things that we hear often in our clinic, the things a lot of women maybe want to know, don't know how to ask. Incontinence. Many think it's maybe something just with pregnancy or, well, I'm getting older, this is what happens. It actually affects women of all ages.
Yes.
A lot of our young female athletes struggle with this and are maybe embarrassed to talk about it. So yeah, I'll let you kind of talk a little bit more about incontinence.
Yeah, and the big thing I think to really get out there, right, is that you're not alone in this. Incontinence is extremely common, but it's not technically quote unquote normal.
Right.
So if you're experiencing incontinence, which again is this involuntary loss of urine when you don't want to have it happen, whether it's like I have a strong sense of having to go to the bathroom or I'm jumping, coughing, laughing, sneezing, you don't have to pee when you sneeze.
Right.
You don't have to be laughing with your really funny girlfriends and have to worry about how many sanitary pad products that you have to bring with you. You want them to be really funny and have a good time.
Yes.
But that's the last thing that you want to have to be concerned about. So coming in and seeing us as pelvic health physical therapists can be very, very helpful. And our area of expertise is really to teach you how do these muscles in our lovely pelvis, how are they functioning together? What's the coordinated movement like? So you probably have heard of a Kegel or a Kegel, depending on who you're talking to, but it was Dr. Arnold Kegel that discovered them a long time ago. But, it's not really all about the Kegels, right? You wouldn't say so?
No, and I think sometimes when people say, I've been doing my Kegels and I'm not getting better, it's like I kind of want to cringe a little bit because a lot of women are trying to do them and they feel like they're not doing them well, so they feel like they're failing and they're more frustrated and there's no hope. Well, when your muscle's already doing this, all the time, when you really need it to pinch off to stop that flow of urine, it's got nothing left because it's been doing this all day. So we talk often with that pelvic floor, if we're sad, angry, scared, mad, frustrated, stressed, we tend to kind of hold. So again, if you did this all day and then I said, hurry up, shrug your shoulders, you'd go, I think I am, I don't know. So your brain gets a little confused as to what it's supposed to be doing, what are you asking of it. So that's where it's important to have a pelvic therapist assess the muscles and see what's really going on down here.
Yeah, your pelvic floor muscles really are the foundation of your core, and there's so many different functions of the pelvic floor, but ultimately they have to have proper mobility.
Yes.
And then from that mobility you can develop strength. So if you don't have the ideal kind of movement patterns in the pelvic floor, it's going to be really difficult for you to strengthen them and help them become more efficient to be able to, as Liz said, kind of pinch off that urine flow and allow you to not have any type of leakage occur.
And I think it's fun when we have patients come in and their primary concern is incontinence, and then we start talking, how is your low back? Are you getting headaches, cervical tension? And they're so surprised we know this. And again, our body's so intricately connected, and these muscles have such a function in our stability along with the sphincter and even with intercourse. So a lot of times people with incontinence also are having pain with intercourse. So to me, it's always interesting when they come in as that being their primary issue. It often cues to us there's probably more going on, because if it can't coordinate properly to do this basic function of stopping urine, there's probably a lot of other areas that our body's compensating and the muscles aren't able to do their job as well as we'd like.
Absolutely, absolutely. So again, little brief talk here on incontinence, just so that you guys understand that there are individuals like ourselves with the proper training to be able to help assess your pelvic floor muscles, get you the care that you need so that you don't have to worry about leaking urine at times of the day that you shouldn't be leaking urine, and in general we shouldn't be leaking urine. So please come see us, please reach out. We are here. This is what we do on a daily basis at Jones PT. And again, we'll do more and more talks. Yes. And if you have specific topics that you'd like to hear more and more about, we'll even come in and probably talk about pelvic floor muscles, so that, yes, you do have pelvic floor muscles. There are muscles in this area of the body. We'll talk about those things, because our job, and I think our mission, is to really get that education out there and to give you guys kind of that knowledge so that you can determine what's in your best interest and really get the care that you need and deserve.